Good day, everyone. We are Group 1 from Block NB, and we will be presenting to you our concept map about peptic ulcer disease. Before we delve in further on the specific details about peptic ulcer disease, let's first understand what this illness is. Peptic ulcer disease is defined by the condition in which painful sores, or ulcers, develop along the lining in the gastrointestinal tract. These ulcers are open sores and are painful, especially when it comes in contact with gastric acid or food material.
There are three types of peptic ulcer. First is gastric ulcer, second is duodenal ulcer, and third is esophageal ulcer. Gastric ulcers develop inside the stomach, particularly in the stomach lining. Duodenal ulcers develop in the upper section of the small intestines called duodenum, while esophageal ulcers develop inside the esophagus.
There are several causes that lead to peptic ulcer. First is decreased mucosal defense against gastric juices. If the mucus that protects the stomach wall from the acidic gastric juices becomes too thin, the juice will be able to digest the stomach itself, which likely results to abdominal pain. Also, excessive gastric acid secretion decreases mucosal defense in the stomach. Second is drinking alcohol. Excessive alcohol consumption will irritate the mucous lining of the stomach and increases the amount of gastric acid that's produced. Third is the infection of the Helicobacter pylori bacteria. Helicobacter pylori bacteria lives in the mucus layer that lines the stomach, esophagus, and small intestine. This type of bacteria can be transmitted through direct contact with saliva, vomit, or fecal oral matter. Helicobacter pylori bacteria can also spread through contaminated food or water. Fourth is smoking. Cigarette smoking increases susceptibility to infection. It also lessens the mucosal defensive factors, which then creates an environment for a development of the Helicobacter pylori bacteria. Lastly is the regular use of non-steroidal anti-inflammatory drugs, or NSAIDs. Taking aspirin, ibuprofen, or naproxen can irritate the lining of the stomach and small intestine. NSAIDs can initiate mucosal injury by their acidic properties. Systemic effects of NSAIDs appear to play a predominant role through the decreased synthesis of the mucosal prostaglandins.
These are the common symptoms of the peptic ulcer disease. First is heartburn. Heartburn is a burning pain in the lower chest. Second is nausea, or the sensation of an urge to vomit. Third are hunger pains. It occurs when there is a strong contractions of the stomach when it is empty. Fourth is abdominal discomfort. Fifth is bloating or belching. It is when the patient feels that his or her belly is swollen after eating. Sixth is burning stomach pain. And lastly, intolerance to fatty foods, or the patient will feel sick after eating fatty foods.
The severe symptoms of peptic ulcer disease includes first, appetite changes. Symptoms also vary depending on the type of ulcer someone has. If a sore forms in a duodenum, for example, the pain usually arrives between meals and goes away after a few bites of food or a glass of milk. But if the ulcer is in the stomach, the discomfort usually flares up during a meal. Both kinds of ulcers can also cause nausea and a loss of appetite. Next symptom is vomiting blood. If you vomit blood, it means there may be bleeding somewhere in your food pipe, stomach, or the first part of your small intestine or the duodenum. Bleeding happens when the ulcer or inflammation damages an artery. Next symptom is trouble breathing or shortness of breath. Peptic ulcer causes the person to have hidden bleeding and may cause trouble breathing. Next symptom is clotted blood in our stools. And last but not the least symptom is unexplained weight loss. Because eating causes pain, many patients with gastric ulcers avoid meals and consequently loses weight.
Some complications that may arise from peptic ulcer include perforation, gastric cancer, gastric obstruction, and internal bleeding. Perforation occurs when an ulcer eats through the wall of the stomach or intestine into the abdominal cavity. When perforation occurs, partially digested food, bacteria, and enzymes from the digestive tract may spill into the abdominal cavity, causing inflammation and infection. Stomach cancers occur when normally healthy cells within the upper digestive system becomes cancerous and grow out of control. Gastric obstruction is a blockage of the path from the stomach to the small intestine. Peptic ulcer may completely block off the path or allow a small amount to pass. The blockage can cause pain and stop food from being digested. Internal bleeding is the most common complications of peptic ulcer. It can occur when an ulcer develops at the site of a blood vessel. Complications of peptic ulcers are relatively uncommon, but they can be very serious if they do occur.
It is important to properly diagnose the underlying cause of ulcer disease before starting treatment, as treatment varies for different types of ulcers. To diagnose a patient with peptic ulcer disease, the doctor may first take a medical history and perform a physical exam. The patient may then need to undergo diagnostic tests such as to detect multiple endocrine neoplasia. This is because peptic ulcer disease may be a manifestation of symptomatic primary hyperparathyroidism, which can be caused by multiple endocrine neoplasia. Second are laboratory tests for Helicobacter pylori. The doctor may recommend tests to determine whether the bacterium H. pylori is present in the body. He or she may look for H. pylori using a blood, stool, or breath test. The urea breath test is the most accurate, where it tests the ability of H. pylori to convert urea to ammonia and carbon dioxide. Third are serum gastrin and calcium measurements, where patients will have their serum gastrin and serum calcium measured to screen for illnesses which can result to peptic ulcer disease.
Number 4 is the screening for Zollinger-Ellison syndrome. The tumors that occur with Zollinger-Ellison syndrome are made up of cells that secrete large amounts of the hormone gastrin. Increased gastrin makes the stomach produce far too much acid. The excessive acid then leads to peptic ulcers and sometimes to diarrhea. If your doctor suspects that you have ZES, he or she will perform a blood test to look for high levels of gastrin or the hormone secreted by gastrinomas. They may also perform tests to measure how much acid your stomach is producing. Number 5 is the upper gastrointestinal series. It is sometimes called a barium swallow. This series of X-rays of the upper digestive system creates images of the esophagus, stomach, and small intestine. During the X-ray, the patient swallows a white liquid containing barium that coats the digestive tract and makes the ulcer more visible. Number 6 is the urea breath test. This test is simple and non-invasive and have been used to identify infections by Helicobacter pylori, a spiral bacterium implicated in gastritis, gastric ulcer, and peptic ulcer disease. It is based upon the ability of H. pylori to convert urea to ammonia and carbon dioxide. Number 7 is the endoscopy. A scope is used to examine the upper digestive system. This process is called endoscopy. During endoscopy, the doctor passes a hollow tube equipped with a lens or the endoscope down your throat and into the esophagus, stomach, and small intestine. Using the endoscope, ulcers would be located.
Treatment for peptic ulcer disease. Neutralizing antacids. Antacids are a combination of various compounds with various salts of calcium, magnesium, and aluminum as the active ingredients. The antacids reduce the acid reaching the duodenum by neutralizing the acid present in the stomach. Its main objectives are to alleviate the pain, relieve pylorospasms, and avoid digestion and corrosion by acid chine. The salt's mechanism of neutralization of acid varies, and each salt has a different mechanism with the ultimate goal of acid neutralization. Antibiotic medication for killing H. pylori. The most common remedy is a combination of antibiotic drugs to kill the H. pylori bacteria and medications to get rid of acid in your stomach. These typically include proton pump inhibitors like Acifex or Nexium and antibiotics. Medications for protecting gastric linings. Sucralfate is the aluminum salt of a sulfated disaccharide. The drug forms a barrier or coating over the ulcer crater, stimulates prostaglandins synthesis, and binds to noxious agents such as bile salts. Although the exact mechanism of action is unclear, it appears sucralfates stimulate prostaglandins, which promote and improve mucosal integrity and enhance epithelial regeneration. Medications for blocking or reducing acid production. Histamine H2 receptor antagonists reduce gastric acid production by blocking the H2 receptor on the parietal cell. Examples of available H2 blockers used to treat gastric and duodenal ulcers include cimetidine, ranitidine, famotidine, and nizatidine. The suppression of gastric acid production promotes the healing of peptic ulcers. The treatment for this is 2 weeks of tripotherapy, including bismuth, tetracycline, and metronidazole.
For prevention, there are 2 ways to prevent peptic ulcer disease. First is to be cautious with pain relievers. People with peptic ulcer disease should use acetaminophen for over-the-counter pain relief. Unless your doctor has said it's okay, you shall not use aspirin, ibuprofen, ketoprofen, or naproxen sodium. If acetaminophen doesn't help with your pain, see your doctor. Second is to protect yourself from infections by washing your hands regularly and consuming foods that have been cooked thoroughly. So this concludes our presentation of the concept map about the peptic ulcer. Thank you for listening.